Hello everyone and welcome to another edition of Townsquare Tableau. I'm Ebenau here, and today we're discussing summer sports injuries for both the athlete and the non-athlete. Whether it's playing basketball in the yard or going on a daily run, we're going to find out what it is you need to do before you head out and what to do if you start feeling any kind of muscle pain or aches. Today I'm with Dr. Daniel Fox in downtown Townsquare at the Center for Sports Medicine. And Dr. Fox, what are some of the more common injuries you're seeing specifically in the summertime in all your years of being an orthopedic surgeon?
It's great to be here. Thanks, Vin, for allowing me to discuss this topic. Because we're in the shore, it's a very interesting type of injuries we get versus if we were not at the shore. I see a lot of injuries on the beach, believe it or not, because of the volleyball on the beach, and there's a lot of people playing in the sand, and we get a lot of sprained ankles, and we get a lot of knee injuries, twisting of the knee. There's the typical injuries that are not related to the shore, just because everyone's out in the summer doing their thing. We see a lot of basketball injuries and football. It's kind of hot, so a lot of the guys are just playing football on the beach and things like that. But it's more a when everyone comes out and starts doing things that I guess they're not really used to, because during the winter and even the spring, they're not, many of the non-athletes are not tuned up, and they get a lot of sprains and strains from not warming up and not being in shape. So it's more of a seasonal type of thing, and being at the shore, we're seeing a lot of injuries from people coming out not being in shape, and also beach injuries. The regular injuries that we typically see is a lot of ankles and knee sprains and injuries, and also we get from people falling and basketball and things like that, and sometimes there'll be people doing a lot of activities that they're not used to. We could see anywhere from wrist injuries when they fall to fractures and things of that nature.
You know, getting to the beach specifically, on that one point you were bringing up, I remember when I was playing football in high school, we had these beach workouts. I mean, and running around on the sand doing anything, it could be a little rough even on the feet. So for anybody who's either practicing with their own team, or they're there just enjoying their time on the beach this summer, families bringing their kids to the beach and trying to enjoy beach ball or volleyball or something like that, is there anything outside of them just casually going to the beach and, you know, being in the water that they should try to avoid or try to look out for before playing anything on the rough surface?
Well, that's a good point. The sand is very different than surfaces that people are used to, like indoor tracks and things at gyms. So the sand, although it's softer than an asphalt, let's say, it does give, and there is a lot of twisting and things like that. So yeah, the only thing I could say is that if they're going to do stuff, they should kind of check the area out and make sure that it's not there's not a lot of divots and things. But I've seen a lot of injuries, such as ACL injuries on kids running around and playing sports on the sand, because there is a giving to the surface, and it's not a flat surface. So yeah, I think the only tips I could give is that if you know you have problems with your ankles or your knees, you should put your brace on if you have one before you do sports on the sand and the beach. And just make sure the surfaces, there's no big potholes and things like that on the beach.
Now, what about those other activities, like joining an adult softball league or playing basketball in the street, or any kind of other activities that people are getting involved in, or even going on a daily run, on whether it's concrete or something else? Should there be certain stretches that people are doing, or certain maybe activities they should avoid during the summer?
Sure. When you have the summer, one of the big things is the heat, And we have people in my practice who do sports medicine, not related to so much the actual injuries, but you know, heat exhaustion and even heat stroke and things like that. So that always goes into hydrating, etc. But when you're talking about specifically injuries, if there is a patient who is, like I said, not normally used to doing a lot of stuff, and they come out there, they really have to go gradual, and they all have to warm up and get their muscles stretched. And because if they're tight and they think they can just go out and play tennis recreational and they haven't picked up a racket in a year, they're going to either hurt their shoulder, hurt their elbow. We see a lot of tennis elbow in the summer for people who aren't used to that type of activity, and then pick it up. We also see golfer's elbow, which is like tennis elbow, but what happens is they come out and instead of playing 9 holes, they'll play 18 holes, and they'll really overdo it, and then they end up having problems with their elbow or their back. And those are things that, you know, once the summer hits, people just think they can go out and do everything, and they really can't because they haven't been doing much the whole year.
In regards to running outside, is there a certain type of sneaker that people should be wearing, whether they've had a history of running on a competitively in races or not? They're just want to go for a daily run and just to try and keep in shape. Is there something they should be doing in addition to stretching, or like a certain type of shoe wear?
Well, they do have special sneakers for runners. They have all types of sneakers now, tennis sneakers, running sneakers. So they're made more towards the runners to give you support, but also they have to. You should make sure that all the sneakers have good arch supports, and we find that you know, there's certain brands that are very good and do have good arch supports and are made specifically for running. And I would not skimp on sneakers or shoe wear, because that can really mess everything else up, because when you start having problems with your feet, it starts affecting all the way to your knees and your back and hip and stuff like that.
What about people overcompensating for one injury over another? If they hurt their feet or their hamstring, or you know, maybe they're a little weak on one side and they try overcompensating on the right side or the left side, can somebody do more damage with an injury whether or not they know they have one?
Well, what happens is a lot of people ignore an injury and then they try to push through it, and we don't recommend that. In the old days, maybe they used to try to tell the patient push through the pain, but now that's not the philosophy. And if you do have something bothering you, you should really get some treatment for it or see a doctor, because if you try to push through it and you start overcompensating, you'll start affecting the other joints and the other parts of your body. And I've seen people with a simple knee sprain, and next thing you know, they ended up injuring their back because they're walking different, and the back ends up sometimes worse than the knee. So yeah, they need to get not to be heroes, and if they feel that something's not getting better in a few days, they should definitely see somebody.
And what can they do right away if they think it's maybe a pulled muscle or a strain or something a little more severe, like a break or a fracture or some sort of a tear? What should somebody do over the course of the summer if they do something right away? Should they wait? Should they go right to ice? Should they try to go to heat?
When you injure a joint, the best thing to do is something called RICE, and that stands for rest, ice, compression, elevation. So any joint like the knee, ankle, shoulder, that's the best treatment initially. You get off it, you put a compressive dressing like a ACE bandage or some type of support brace, and ice it as often as you can for a few days and elevate the extremity. And if that still's not helping, and you can take anti-inflammatories over the counter, they have Advil, Aleve, that type of stuff, but if you're still sore or not feeling better after 3-4 days, I would suggest seeing a doctor, because especially an orthopedic surgeon or a sports doctor, because that means that something's going on that you could just make it worse if you don't get help. And let's just say they do have something that's a partial tear of something, like an Achilles tendon in your ankle, or your elbow, or rotator cuff tendon in your shoulder, something, or even a MCL ligament sprain, or something going on in your knee. If you go see a doctor, a lot of times they'll send you to physical therapy, they'll give you stronger anti-inflammatories, and many times they take an MRI. And an MRI will show a lot what's going on of all the soft tissues and what's going on, because x-rays just show the bone and really don't tell you much about what's going on in the joint. And depending on what it is, in the old days, you know, it would be a lot of rest and therapy, and sometimes you need to have surgery. Nowadays we have stem cells, and we have something called PRP, which is platelet-rich plasma, which we can actually apply or inject into the areas of the injured tendons or ligaments and help them heal much quicker and much better. And then that's something that we've been doing at my practice for the last year and a half, and have gotten excellent results. It speeds up the healing. Sometimes it actually prevents someone from having to have surgery. And sometimes when we do surgery, we add that to help the healing response and to help it heal faster.
What would your treatment recommendations be, maybe before surgery, or an alternative to an opioid-related medicine? Now that being in Ocean County, being in New Jersey, with it becoming more of an epidemic, are there recommendations that you would give out, or you think people should look into to help relieve some of the pain, or help, you know, the breaks, the tears, kind of relieve pressure before kind of going to that advanced step like a surgery?
The pain medication that you're talking about, which is addictive, which is becoming a big epidemic, and it already is in the country, is when patients start getting hooked on narcotics and pain medicine. And we frown upon that, and personally in my practice we do have a pain management doctor, but we try to hold off doing any of that, because pain is a signal from the body that something's going on and something's wrong. So our goal is to fix that problem. If you have to help the patient with to get out of pain in the short term, there's other things besides narcotics. We typically use strong anti-inflammatories, muscle relaxants, because a lot of the pain around the joint, the muscles go into spasm. So we use both of those. The anti-inflammatories is like very strong Advil, but they're prescription. The other stuff that we use is, in addition to ice, which we find is very, very helpful in relieving pain, is some of the creams that they have out there. There's creams with an anti-inflammatory mixture in them, and you rub them on the joint and they actually do help. There's also something called the TENS unit, which is an electrical stimulator, which they use at therapy, and you put it on the area, and it's very, very good for the back and neck. People with back and neck injuries are in a lot of pain, and you put these leads on with these little sticky pads, and it's a battery powered thing. You can put it on your belt or put it in your pocket, and it actually takes away the pain by causing electrical stimulation to the area of pain, and it really helps. So between creams, medication, and even the physical therapy I talked about, the electrical stim, TENS units, there is a lot of alternatives. If personally, I only give really the narcotics in a very limited dose, and that's after patients have surgery. But if the patient's that bad that they need to be on constant narcotics, then there's a problem, and the problem should be fixed, and that's when surgery or the stem cells, PRP, all that comes into use. And then one other thing they have now, there's something called it's like, some people call it laser, but it's not exactly laser. What it is, it's called the 10X procedure, and it's a ultrasonic bombardment with a little wand, and they make a little tiny needle incision. It's not even an incision, it's like through a needle into the area where there's damage, and this actually removes the damage tissue and gets rid of a lot of the damaged tissue which causes pain, and then you put the PRP or stem cells in there, and what that does is helps regenerate and heal the damaged tissue for Achilles tendons, for the elbow, tennis elbow, for the knees, even different injuries to the knees, as well as the shoulder, rotator cuff, and there's just a lot. It's being used now, and that's like the cutting edge.
One final question, just about summer sports injuries in general. So people going out, whether it's to the beach, to the park, a block party where they're playing basketball, the pool, no matter what summer sports activity they're doing, what is it you think people need to know about before they go out and play, what they should know during, and what they could do after, whether they injured themselves or not?
Before I answer that question, I just want to say one more thing. Obviously, in the summer, one of the biggest sports people do is swimming. And a lot of people do swimming recreational in the ocean, and they do many go into the pool or the lake. And that is actually one of the best sports you can do for general aerobic conditioning and just to get all your muscle groups working. So swimming is very good, but once again, all the story that you should not eat and then go swimming is true, because you need your blood flows to your muscles and not to your digestive system, so you have to wait a while, and that's more of a medical than an orthopedic problem, but swimming is very good, and they should just be careful not to overdo it and get exhausted in the water, because obviously that could be a problem. But getting back to your specific question, what I would recommend is the same thing I recommend to all my patients during the whole year, is except more stressed in the summer when they're more apt to overdo it and be out there, is to just warm up, just to stretch, because you're going to get dehydrated and you need fluids, and obviously the fluid balance in all your muscles is very important. So you have to make sure you're well hydrated, stretch, and make sure you don't overdo it, and take things in small segments and build up to it over time, as far as whether you're going to play 18 holes of golf and you start off with 9, or whether you play 3 sets of tennis and you start off with 1 set, and just common sense. And if you do have problems with certain joints and the doctors say, they have diagnosed it, then I would certainly get braces and use them during the sports, because those are important. They support the area that you're having the problem with. And if I don't say to use the brace all the time, but certainly when you're going to go out and do these activities. So everyone should enjoy their summer sports, but they should basically be thinking before what to do, so they don't to prevent them from getting hurt.
Dr. Fox, thank you for giving me some time today and providing some helpful summer sports tips.
You're welcome, and thank you.
All right, that's Dr. Daniel Fox, orthopedic surgeon here in Toms River. I'm Vin Ebenau for another episode of Townsquare Tableau. For more on this and other news stories out of the WOBM newsroom, head over to WOBM.com, or more sports stories at shoresportsnetwork.com.